Are joined right now by Dr. Todd Eller, and he's the Director of Infectious Diseases at South Shore Health to talk about COVID-19. Doctor, it's always great to see you, and thanks for your time. Today, we will, sadly, likely hit 10,000 deaths in the state from COVID-19. Daily case counts are getting close to the levels that they were at the peak earlier this year, and the state is going to begin setting up temporary, well, at least it says it wants to begin temporary field hospitals again. The governor says there's no reason to be alarmed, being on the front lines. Is there a reason to be alarmed?
So, Ed, there definitely is, because, we're just heard yesterday there were 2,500 cases, 659 hospitalized patients. That's more than double from last month average. But I do think the governor has been doing a good job, and I want people to look at the Boston Globe article today by the collective infectious diseases chiefs of the academic centers. And basically what they said is his targeted approach is the right way to go for Massachusetts for now. Curfews, tightening the limits on gatherings, the mask mandates, these are things that hopefully will push us in the right direction. That doesn't mean that other states may need more stringent regulations.
So, Doctor, let's talk about the spikes that we're seeing right now. A lot of people are saying, you know what, Halloween happened, people got together, now we're seeing the numbers rise. New Jersey, for instance, reporting a number of outbreaks, all tied to Halloween parties. That's what they're reporting. So if that's the case, could we expect the numbers to drop? Or does Thanksgiving bring a whole host of different problems and numbers spiking again?
Maria, I really want to tell you that numbers are going to drop in the next weeks or months, but that's very unlikely. They're going in the wrong direction. The trajectory is just, we're seeing more cases, more hospitalizations, and more deaths. So in light of that, I think what Halloween brings up is the gatherings, these informal or formal gatherings in the households. You hear me say this time and time again, the majority of transmissions are occurring in our homes. The best way that we can prevent transmissions is we have to change our infection prevention strategies within our homes. I think that's the focus right now.
We talked about this before we went to commercial. There's a new poll that shows that fewer than half Americans say that they would definitely comply with another lockdown. So here's the first question I'm going to ask you. Should a lockdown be on the table as an option?
So, Ed, right now, as you know, Massachusetts does have a lockdown. Now, that happens to be between the hours of 10 p.m. and 5 a.m. We want to prevent that from going further. Again, back to the first question. I think we have to do these things as individuals, masking in public and in the home, keeping our bubbles small. Thanksgiving, for some people, we may have to sit that out, keeping our guest lists, really very small.
Right.
These are opening the windows, improving ventilation. These are the things that are going to prevent the forced stay-at-home guidance.
Could it be too late for another lockdown? Could it be too late for that?
It's a great question, and I'm not sure about that. I mean, it's possible it's too late, but I think if we really are change our behaviors within the home, we can potentially prevent a stay-at-home guidance in Massachusetts.
All right, Dr. Todd Eller in South Shore Health. We always appreciate your insight and your time. Thank you, Doctor. Be well.
Great.